Assalamualaikum, good morning and welcome everyone to our forum. Ladies and gentlemen, may I have your attention? The forum topic is about diagnosis and treatment. Honorable Ms. Nur Shahirah binti Muhammad Nawi, distinguished guests, ladies and gentlemen. Before our forum gets started, I would like to introduce our panelist one is Nur Hai Hafifah binti Baharum. Panelist 2, Kastina binti Muntaha. And last panelist there is Nur Fatim Fatihah binti Zurustan Effendi. In this topic, traumatic brain injury is happen when a sudden external physical asset damages the brain. It is one of the most common cause of disability and death in adults. So, without further ado, I would like to welcome panelist 1 in explain about prevention for traumatic brain injury. So, the floor is yours.
Thank you, moderator. A traumatic brain injury (TBI) can be caused by a forceful bump, blow, or jaw to the head or body from an object that pierces the skull and enters the brain. Not all blow or jaw to the head result is in a TBI. Some types of TBI can cause temporary or short-term problems with normal brain function, including problems with how the person thinks, understands, moves, communicates, and acts. More serious TBI can lead to severe and permanent disability and even death. Some injuries are considered primary, meaning the damage is immediate. Other outcomes of TBI can be secondary, meaning they can occur gradually over the course of hours, days, or appear weeks later. These secondary brain injuries are the result of reactive processes that occur after the initial head trauma. There are two broad types of head injury, that is penetrative and non-penetrative. Penetrative TBI happens when an object pierces the skull and enters the brain tissue. Uh, for penetrative TBI, typical damage only part of the brain. Non-penetrative TBI is caused by an external force strong enough to move the brain with the skull. It can cause include fall, motor vehicle crash, spot injury, blast injury, or being struck by an object. Some accidents, such as explosions, natural disaster, or other extreme events, can cause both penetrative and non-penetrative TBI in the same person. Uh, what are the leading causes of TBI? The leading cause of TBI can happen when we fall. According to data from the Center for Disease Control and Prevention, fall are the most common cause of TBI and occur most frequently among the youngest and oldest age group. Secondly, TBI can also be trauma accident. Accidents that involve being struck by or against an object, particular sport-related injury, are a major cause of TBI. Anyway, from 1.6 million to 3.8 million sport and recreation-related TBI are estimated to occur in the United States annually. Next, vehicle-related injuries are also can lead TBI happen. Pedestrian involved accident as well as accident involving motor vehicle or bicycle are the third most common cause of TBI. In young adults aged 15 to 24 years, motor vehicle accidents are the most likely cause of TBI. Lastly, violence can cause of TBI. Also include abuse-related TBI, such as head injury that result from domestic violence of shake baby syndrome and gunshot wound to the head. TBI-related incidents aged 4 and younger are most likely the result of assault. That's all from me.
Okay, thank you for the clearly information from panelist 1. Okay, we continue with our panelist 2. Panelist 2, as a medical, is there any recovery chance for traumatic brain injury? So the floor is yours.
Thank you, moderator, for the good question. There are recovery change for traumatic brain injury. In the past, most rehab specialists believe that TBI recover peaked around 2 years post-injury. However, research demonstrates that this idea is false. In fact, TBI patient can recover their ability after the 2 years mark. For example, a study that following of a TBI patient for a decade found that even a 10 years mark, some patients were still improving their function. One TBI patient testimony explained it at 20 months after recover, I was not yet reading or writing as I am student. Today, I also still needed internet care around the clock because at the long-term follow-up, I can now drive and live on my own. I will never have been able to make progress in my rehabilitation had stopped it at 20 months. Therefore, a full of a functional TBI recover is almost always possible, even though it may take several years of decades. But in order to make this type of progress, you must take intervention. In fact, without constant work, brain injury recovery can stall and even regress. Therefore, it is critical of TBI patient to be proactive in the rehab. The more you work to promote a full recovery from TBI, the more success we'll enjoy. Good recovery is the most common outcome for those surviving several closed head injury. 20% of the several closed head in or 40% of all survivors reach a good recovery. Good outcome does not mean recover back to the baseline progress to the injury. That's all. Thank you.
Okay, thank you for the panelists too for the explanation. Now I would like to invite our last panelist. Panelist 3, can you explain about the symptom commonly happen for patients and what the ways prevention in these issues?
Thank you, moderator. Today I want to share about symptoms and ways to prevent chronic brain injury. First, symptom of chronic brain injury. There are many symptoms of chronic brain injury such as behavior or mood change. This is because feeling of sadness, frustration, and loss are common after brain injury. This feeling often appears during the later stage of recovery, after the individual has become more aware of the long-term situation. If this feeling becomes overwhelming or interfere with recovery, the person may be suffering from depression. Next, confusion or memory problems. From my point of view, TBI affects short-term memory more than long-term memory. People with TBI may have a tough time remembering to remember. This means remembering to do things in the future. Finally, the symptoms of CTE may include memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, anxiety, Parkinson, and progressive dementia. After that, sleeping too much or too little. I guess that sleep disturbance has been found in people with all severities of brain injuries from near to surf. Sleep is a complex process that involves many parts of the brain. For this reason, and depending on the location and extent of injury, many different kinds of sleep disturbance can occur after brain injury. Next, way to prevent chronic brain injury. There are many ways to reduce the chance of sustaining a traumatic brain injury. First, buckle up every ride. For example, wear a seatbelt every time you drive or ride in a motor vehicle. This is because being buckled up during a crash helps keep you safe and secure inside your vehicle. Being completely ejected from a vehicle is almost always deadly. So I think wear a seatbelt is a very important way to reduce a traumatic brain injury. Second, wear a helmet. For instance, wear a helmet when ride a bike, motorcycle, snowmobile, and scooter. From this point, helmet can create an additional layers for the head and thus protect the wearer from some of the most serious forms of traumatic brain injury. Yes, of course, a helmet aims to reduce the risk of serious head and brain injuries by reducing the impact of force or collision to the head. Last but not least, don't drive under the influence of drug or alcohol. I believe that the principal concern regarding drug driving is that driving under the influence of any drug that's actually on the brain or impair one motor skill, reaction time, and judgment. Drug driving is a public health concern because it puts not only the driver at risk, but also passengers and others who share the road. In the case, drinking impairs the ability to drive and increase the risk of case accident. Thank you.
Alright, thank you for the panelist three. In my opinion, TBI can be classified based on severity ranging of mild traumatic brain injury, contusion to severe traumatic brain injury, mechanism close or penetrating head injury or other features occurs in a specific location. In our discussion just now, it is important to be emergency treatment. People with moderate to severe injuries are likely to receive treatment in an intensive care unit, followed by news, neurosurgical ward. Treatment depends on the recovery stage of the patient. In the acute stage, the primary aim is to stabilize the patient and focus on prevention further injury. Alright, ladies and gentlemen, now we have come to question and answer section. Do we have any question from the panelists today?
I have a question for panel 3. What are the two types of traumatic brain injury?
I will answer your question. The answer is close brain injury and penetrating brain injury. Thank you.
Okay, next question.
I have a question to panel 2. The treatment of traumatic brain injury.
Thank you, panel 3, for the question. Okay, the treatment of traumatic brain injury is the immunization emergency care. Second, surgery. 3, medication. That's all. Thank you.
Thank you for the all question that give from panelists. So I think we are going to finish our forum today. Thank you for the all panelists. Thank you.
Thank you.
Thank you.